Thank you. Thank you very much. Thank you so much. Thank you so much for joining our webinar session today. Today, I'm going to attempt to take you through a demonstration through this webinar session that we're hosting today and introduce to you one of our very awesome products, Elixir Live. But before I go there, I'd just like to introduce myself, my colleague Jabu, the company that we work for, and what we stand for. Okay, so my name is Sheila Taskiran, and my colleague's name is Jabu, and he will be handling the questions and answers after the session. But we work for a company called Altron, and we are part of the Altron group. Okay, we are part of the Altron HealthTech team, and Altron HealthTech, within the group Altron HealthTech, we have got software, we've got a switching house, and we also offer a bureau service, which means should you need your accounts to be claimed for, we offer that service as well. But today I'm actually going to be taking you through a practice management application, which is a cloud-based solution. And what that means is it's a practice management billing software system used in doctors' practices, medical practices, to run the accounting as well as patient management within the practice. This is a cloud-based system, and I'm going to talk you through it. But before I actually get to show you a demonstration or a product demo of our system, I'm going to run you through a video, and I hope our video captures your attention. Before I get to the video though, I'd just like to add, regarding questions, we would prefer that the questions be held for us. Ask the questions, feel free, but keep your questions, and note that we will handle your questions at the end of our presentation slide. So I'm going to take you through the video now.
Overwhelmed by the administrative and financial burdens of healthcare? Elixir Live, a cloud-based PMA, enables seamless medical practice management. A feature-rich diary becomes the backbone of your practice, where you and your staff can book accurate appointments, immediately see outstanding balances, add new patients, files, and information, perform real-time membership validation and benefit checking, bill and allocate payments accurately, and send bulk email and SMS reminders, all from one tab, with easy movement between functions. It's multitasking made easy. At month end, effective reporting and analytics make reviewing, tracking, and understanding your practice a painless process. And with Elixir Live's powerful follow-up manager, you can customize and effortlessly manage credit control, so nothing falls through the cracks. All this in a secure cloud-based environment with a PMA that can be accessed anytime, anywhere. Elixir Live, one of Altron HealthTech's proven, trusted healthcare solutions, giving you back time with your patients.
Thank you so much. I hope you got some insight with our video there. I'm going to switch over to a live demonstration of the program. This is your practice management application known as a PMA solution. This is the program that is used in doctors' rooms to basically keep track of your patients, run your diary, do your billing. And as I asked earlier, I would like that the questions be handled at the end of the session. I'm going to take you through a live demonstration now. And my colleague Jabu, I just want to check with Jabu. Jabu?
Hi, Sheila.
Hi, Jabu. I'm just going to speak to you as well within our presentation. I'd like to be interactive with you, and maybe I will just give you some questions as we're going along, just to make sure that our audience here today understands what Elixir Live is all about. Would you like to add something at this point, Jabu?
That is perfect, Sheila. I'm perfectly happy with that. Just a reminder to the live audience that this is a recorded session, and therefore it will be made available to all of our attendees via YouTube.
Thank you very much. Jabu, may I just ask you if you can see that my screen has changed? I'm now on the Elixir Live software system, and you should be seeing my dashboard.
Definitely. All good from my side. I can definitely see the dashboard.
Thank you so much. I'm going to use my mouse, and as I click on my dashboard, some of the icons here will become highlighted, and I will take you through the dashboard before I take you into the software. So here is the dashboard. Before you get into the program itself, you view the dashboard. I like this dashboard extremely much because I can see at a glance that I have 10 account notes, which means if I'm the practice manager or the receptionist, I've left some notes here which I need to follow up on. If I click on view, I will be able to see what notes are there, who do I need to follow up with. It's a reminder and it's on my dashboard. Here we've got SMSs. SMSs you can purchase directly from us at Medimass. We link the SMSs to your diary, as well as you can send out accounts, personal messages to your patients. On my dashboard as well, you can see that if I've got error claims that need to be fixed before we resubmit to the medical aid, you can just view these claims and fix them. Before you even start your day, you've already fixed your claims, that is settled, you can continue. Here again, you can see I've got 193 claims with rejections. This will also, I can fix my rejected claims, sort that out and submit them. On this side with the purple icon here, you can see there's Recomed. Recomed, I'm going to explain to you a little bit further when we get into our diary. And after this presentation, I'm just going to take you through a very brief video explaining Recomed, who they are, what they're all about, how do they fit in and tie in to Elixir Live. So you can see here, you've got 20 unconfirmed appointments, and I will explain this as soon as I get to my diary. But here you can see elective update. Dear Elixir Live user, the nice thing about this program, which I love, it's an interactive program. So if our developers or there's an update, something has changed, they will notify the practice. The practice manager will get notifications on the application of anything that has been updated in the system. So you've got your notification, it's on your screen, and this is, as you get into the practice in the morning, you can see what's happening. We've told you it's on your screen, it's on your dashboard. Okay, so I've spoken about the dashboard. I want to take you through to the accounts screen. And I'm going to click on accounts. And before I see a patient or make an appointment with a patient, I've got to make sure that my patient is actually loaded in my program. So here I'm clicking on this new button here, which means I can click on that and go and create a demographic of my patient, collect all the relevant information, the name, the surname, the ID number, the medical aid details, all of that I will collect. Or one further, if you go across here, you can see there's a switch on icon. And on the switch on icon, you can see new account from MSV. What does MSV stand for? It stands for Medical Scheme Validation. So some of our schemes are participating schemes in terms of real-time functionality. So one of the participating schemes is your discovery, for an example. If I go and add an account, if I click on that, if I go and add an account and my patient is Discovery, because Discovery is a real-time participating scheme, I can then either put in the ID number or membership number, and if I click on the next button, it will go to the scheme in real time, validate my patient, and also bring back some of the information from the scheme.
All right, Sheila,
remember, yes,
that's
yes,
excellent information. I just wanted to find out, is it possible for us to perhaps just expand the screen? Is that possible? Will you be able to do that?
Unfortunately, I don't see the option. Is it actually very small on your side? That's the furthest it can go.
If that's the best, then it's absolutely okay, Sheila. We can just carry on.
Oh, no problem. Thank you so much, Jabu. Thank you so much. Okay, so the validation.
Sheila, before you continue,
yes.
Sorry for interjecting. What the viewers can do is they have a little panel bar with 3 little dots that says more actions. If they click on that, they can enter full screen mode. So that'll give them a better view of your presentation.
Thank you so much, Mervyn. Thank you very much. Okay. Okay, so yes, we were talking about validating your patient. Not only can you validate that the patient is actually a member of the scheme, but you can get some information back onto your Elixir Live program. But remember that the receptionist still needs to check the address, add in those details and the contact details. So that is one way of ease of use with Elixir Live. Remembering that Elixir Live is a cloud-based solution, we've innovated and come up with the best solution for the situations that we are facing right now, where we find ourselves having to do all of these things electronically. Benefit availability, I'm going to touch on that briefly. Also, you are able to ask the medical aid for an amount. For example, if you are looking for 1,000 Rand for your consultation, remembering this is for your real-time schemes only, and these are participating schemes. They have opted to be real-time and make their data available for us. So you can request an amount and check it at the scheme, and it will give you the yes or no. Yes, they have it available, or no, they don't have it available. Moving on, we've got a Lockbox icon on the side of switch on here. What is Lockbox? Lockbox is a third party. It's a company that we've decided to work with and integrate with. And how does this help the practice? For an example, instead of a patient coming into the practice and filling out long forms and all the demographics, which they could possibly do at home, we've made it easier. We've integrated with Lockbox. And if you are having a Lockbox account, you can send your patient an SMS. The patient will receive this SMS and be able to go in and fill in their demographics before they get to the doctor's rooms. I'm just going to click on that. So when the patient has already done their demographics at home, they've received the link, they filled in their details. What happens is when they get to the rooms, the receptionist or the practice manager, all they need to do is put in the ID number or the membership number, find the patient and pull the traffic right through onto Elixir Live. So that's a very cool feature. That is absolutely cool, because I know personally, go to the doctor and that long filling in of forms is so tedious. Thankfully, we can do it now via Lockbox, and it's integrated in Elixir Live. I'm going to take you through to the diary. And as you can see on my diary here, you can have more than one diary view. If this is a GP practice or a group practice that has a GP, a dentist, a physio, you can all use one program and use the same diary and have different views in the diary. I'm going to go ahead. I want to book an appointment for a patient through our diary system. I can choose to just look at my diary, or I can choose to look at everybody else's. In this case, I want to look at our diary only. I'm going to book an appointment for us here, and there we go. You can see that as I'm booking an appointment here, if this is a brand new patient, I can go and do a validation of that patient directly from my diary. Okay, so I'm going to go and book the patient. I'm going to select my patient. And I'm also going to, you can see on my diary here that on the comment screen that I can actually tell the doctor, if I'm the receptionist, what is the patient coming for. So you can leave a comment, you can send an SMS and as a reminder, or you can pre-populate these SMSs in advance that they go off at certain times. So I'm going to book the appointment. The nice thing about this is if the doctor is on his diary screen, he's able to see the queue, how many patients are waiting for him in the waiting room. And also the reception is able to tell doctor that, okay, patient is arrived and the patient is in reception. Change color for us. So this is a colored coded diary. Doctor will know, okay, I've got 4 patients sitting in the waiting room and the next patient is Sandra. And Sandra actually owes me a certain amount of money, but according to my books here, Sandra doesn't owe me anything. A comment, if the receptionist left a comment there, we could actually see the comment. Jabu, at this stage, would you like to just add something here about the diary?
Sheila, I think you've covered pretty much everything about the diary. That's absolutely great. And just also to remind our attendees that they are able to use the question and answer field just to post some of their questions. I do see a few questions are coming through and we will address them as soon as you're done, okay?
Thank you very much. Thank you very much. I'm just
Sheila, just one more thing quickly. Can I
Yes.
ask you to perhaps turn your camera off so that we can expand the screen for some of the viewers?
Okay, my camera is off.
Thank you. Yeah, that'll help. Thank you.
Thank you. Thank you very much. Are you able to expand your screen? Okay.
Yes, Sheila, I think that's perfect.
Perfect. Thank you so much. Okay, so I've booked an appointment for a patient and I'm right-clicking on the patient. First and foremost, I can see if there's a money outstanding on this patient's account. And I'm going to take you through a couple of things here. Here is something called an e-script. E-script is where the doctor is able to go in and do a prescription. HealthSoft, we offer HealthSoft. Within our program, all the doctors got to do is sign up. It is absolutely free of charge. We then give you access to a prescription tool, which is built into the program. You right-click on the diary and you can do a prescription. You can also go and leave some notes from your diary. Here it says documents. You can upload or scan documents or pull them through from your computer or from your scanning machine and upload them onto the patient's file. For dentists, you have access to dental charting. And before I take you to the billing screen, I just want to cover some of these icons on the top here. You can see we've got switch on here as well, which means you can do a validation from the diary. And we spoke earlier from the dashboard view about RecoMed. I'm going to cover that in a little video slide that I've prepared for you at the end of this live demo. So now I'm going to click onto my billing screen so I can bill directly from the diary. Bill. and it'll take me to a billing screen. And what I'm going to cover in this billing screen is, this is where you go and create a claim. This is preparing a claim to be submitted to the medical aid. It'll ask you for your tariff, and it will have the description, your ICD-10 code and authorization code. Your pricing, we will help you with your pricing in terms of your payment arrangements. Otherwise, we set the rates according to the medical aid rates. But what I do want to cover here is something called macros. Macros is, each and every practice has got recipes of codes that they group together, that they charge always together. And for example, we've got a test here, it's just called test, but we can see in this macro they've got volume and solution. First consultation, you've got your consultation code, you've got your test, and you've got your volume and solution. If I choose one of these macros, a bill will be created. I'm just going to select one of the macros. You can see I've already put in an ICD-10 code in there. But if that's not your ICD-10 code, here is your search button where you can go and search your code. We've got all the ICD-10 codes in the system with an easy search functionality. I'm going to click on OK there, and my bill is done. Should I want to delete or edit, I can do that now before I click on my save button. Once I've clicked on my save button, you can see it's ready to be submitted to the medical aid. I can untick those because I don't want to submit this account. This is a cash patient, or this can be an estimate, for example. I'm not submitting it to the medical aid. I just want to do an estimate, which I'm going to click OK on, and an estimate quotation is done from my Elixir Live. Here's my estimate. We will help you to set up your logos on your quotations, your invoices, and your statements. And I want to show you from here, you can email this invoice, estimate, or quotation directly to your patient. You select your email address or add an additional one there, and you can email directly from here. Okay, so that is our billing screen there. I'm just going to take you through a couple of reports. Reports are what you draw at the end of every month from the system. You want to see your age analysis. You want to see your turnover reports. We've got your standard reports built into the program. Further to that, we've got something called business intelligence reports. So with your business intelligence reports, you can then do your daily summary, a bit of statistics. We've got quite a few business intelligence reports. We've listened to our clients, we've given them what they've wanted, and we've made it available to all other practices as well. And we will take you through that. Okay, so those are your reports. Here is a follow-ups manager. You can do follow-ups, set reminders for yourself, like action plans, who to follow up, when, and for what, and you'll get reminder pop-ups coming at you, reminding you of what to do. Your inventory, if you keep stock in your practice, we've got a stock control module available for you in Elixir Live. We will train you on how to use this, and you are able to keep accurate record of your stock. So if you give out medication, dispense, you can say set it on a minimum of, I've got 5 left over. It'll pop up and say you've only got 5. You can run reports on who you dispense to. So yes, it's a full financial stock control module that's available for you there. Okay, what I want to take you next through is something in the system which we called analytics. With analytics, it's your reporting. I'm just clicking on there for you now. It is your reporting. So should you need your financials to be exported from the program, you can request whatever report you are looking for, which is your age analysis or account transactions or account list, whichever report you're looking for. You pull and draw that report, export it in Excel, and you can email that off to your accountant or whoever needs these financials, or whoever is working with your books. I'm going to talk to you about a feature which is ERAs. I'm going to click on that for you now. ERA stands for Electronic Remittance Advice. So what happens with an ERA is that we ask you to get registered with the schemes, but we help you with that. We send your documentation through to the medical schemes. It takes a while, but it does get done. Once you are registered with the schemes, you will then be able to receive your remittance advices electronically. They will come in this section here. You will be notified that you have a remittance advice available, but before you reconcile, obviously, you've got to check the bank balance that the money has been paid in, and you click on the reconcile button and your accounts will be reconciled. That is what I'm going to cover here in our program, in this demo today. It is a full-on practice management software system. Before we close our session and open up for our questions, I just would like to take you through to a video explaining our RecoMed integration. So you saw the icon in our diary, you saw it on our dashboard. What is RecoMed? RecoMed is a third-party company, but we've integrated with them. And what do? Some of our doctors like their diary made available on the internet. For example, after hours, I would like to see a doctor, my child is sick and I'm a little bit worried, and I would like to see which pediatrician, for example, is available early morning because I'm really worried about my child and I want to make this, I want to make an appointment to get my child there. So we've integrated with RecoMed. I'm going to play this video and I'm going to talk you through the process of what exactly happens when you book an appointment online. Okay, so as I showed you on your home page, you will see a dashboard view. Here you can see on RecoMed, you've got 4 unconfirmed appointments. So you're a doctor, you've made your diary available on the internet. I get to the office in the morning, I can see as a receptionist, I've got 4 unconfirmed appointments. So when I click on the update now, or alternatively on the diary tab, I can confirm or decline these appointments. So when the patient books something online, does not mean that this appointment is confirmed. It will come in under your unconfirmed appointments. It will show you on the sidebar that these are unconfirmed appointments. I, as the receptionist or the practice manager, need to do something with these appointments. So I will view the appointment. The patient would have selected the doctor that they want to see and the time slot that they prefer. I will have a look at this and see if it's all feasible and perfect before I actually go and confirm this appointment. So we will review the patient's request. Once we're happy with all of it, we will click on confirm to accept this appointment. Once we've done this, this will submit the confirmation to RecoMed and keep the appointment in our diary. We will also receive a pop-up notification confirming this status. Everything has changed now. It's moved from unconfirmed to confirmed, and the patient will receive communication from your practice via SMS or whichever way the practice communicates with the patient, whether it be email or SMS. And that is how you work with your appointments from RecoMed. Thank you very much. Before we close off for questions, I just wanted to add this. These are our screening devices. We are working with these right now. These are also available through us at HealthTech. You can speak to the account managers. You can go onto our website, and the account managers will definitely make sure to get back to you to discuss all of the different screening devices that we have. Thank you very much. And Jabu, I'm going to open up for questions now. Thank you.
Perfect. Sheila, thank you so very much. That was very insightful and it is highly appreciated. Right, so we do have some questions that were posed in our question and answer field, right? The first question from Anonymous, right? Just wanted to know, is the system linked to all medical aid schemes for real-time viewing?
Okay, that's a good question. That's a very good question. Not all schemes are real-time schemes, and this is not because Ultron HealthTech does not have the ability for real-time. We are able to work with each and every scheme that is a real-time scheme. However, some of the schemes have opted from their side not to be real-time. So we've got approximately 85% of the schemes that are real-time, but some of the smaller schemes are not real-time, and that is not because we are not real-time. It's the scheme that has not decided to participate and become a real-time scheme. I hope that answers the question there, Jabu.
All right, perfect. So basically we're saying we are definitely real-time for all real-time schemes. We can see all the scheme responses in real time as long as that scheme is a real-time scheme. Is that correct?
Yes, as long as the scheme is a real-time scheme, yes.
Perfect, perfect. Now, we do have a question from Paul just around the Lockbox feature. Paul just wanted to know if Lockbox is POPI compliant.
I do know that they are. I actually have come a long way, and I've been working with Lockbox quite closely. I know that they are definitely POPI Act compliant. You know, they send a secure link to the patient. This patient has consented to give the demographic detail through to the practice. This patient is a member of this doctor's practice, and there is a consent form that is involved. So yes, as far as I know, Lockbox is POPI Act compliant.
Perfect. Thank you very much, Sheila. We do have a question from Anonymous just around the whole SMS and email feature, right? So Anonymous just wanted to find out how much credit is required to send an email and as well as an SMS. So those are two different functions, the email function as well as the SMS function. They just wanted to know if some sort of credit is required to send the emails as well as the SMSs.
Okay, I'm going to handle the email one first. With the emails, I know that there's no RAND value or credit attached onto the email function. That is, as long as you've got an internet connectivity, obviously you need an internet connectivity to operate a program like Elixir Live, because it is your cloud-based solution, so you do need internet. So as long as you're on the internet, you are able to email without any credit or RAND value attached to the email. However, with the SMSs, we currently at the moment, we do sell SMS bundles to our clients, and you purchase your SMSs directly from us at this point. And yes, this is how it works with the SMSs. You have to purchase SMSs from us. And I know that the pricing is reasonable and it's within the confines of RAND value according to what SMSs go for.
Perfect.
The nice
perfect,
thing
Sheila.
that it's linked to your program.
Perfect, Sheila. And I'm sure the relevant account manager who will assist the practice will be able to provide the values to those SMSs and how much they may cost, correct?
Definitely for sure.
All right, perfect. Okay, so we've got another question from Anonymous, and Anonymous is asking, what is required or involved in migrating from Elixir, which means Elixir Classic, to Elixir Live? Can we transfer all of the information over, including accounts, and debt, debts, and also age analysis. So that's the question around what is required in moving over from Elixir Classic to Elixir Live, and the information that is able to be carried over to Elixir Live from Elixir Classic.
Okay, I'm going to answer this as best I can. Elixir is it's a program, it's our program. So comfortably, I can say to you that your demographics, your account numbering, your financials, everything is able to be transferred from your Elixir program to Elixir Live. I want to just point out to you that it does take a couple of days, between 3 to 5 days, for our team to do that conversion for you. So the term that we use there is a conversion. So we will convert your data from its current format and we will put it into Elixir Live. And I've had nothing but success stories on all the conversions that I've been involved with from Elixir to Elixir Live. Does that answer the question, Jabu?
No, definitely does, Sheila, definitely does. Right, so we have covered the migration process, and then we just want to also find out from Anonymous, does the system also pick up dependent codes?
Definitely. If you go back to the beginning where I went into the account screen, and this is for your participating schemes. For the non-participating real-time schemes, you've got to go and manually capture your patient and the dependents. We will train you on that. All of that is covered in our extensive training. You know, our training is a 2-day training course. And why it's 2 days is that we want you to learn how to navigate through the program. Firstly, by learning how to capture your patients and the dependents. But let's use the real-time scenario. It's a discovery patient. You can then pull that whole card through from the medical aid using the ID number of the main member or the medical aid number. However, on that, I just want to remind you that you have to check your address and the telephone details of the patient. But yes, all the dependents will be picked up and put into the system either manually, or if it's a participating scheme, you pull that through from the medical aid, you check the addresses, you check the telephone numbers, and you're good to go. Jabu, is that a good answer there?
That's absolutely perfect, Sheila. Thank you very much. That's absolutely perfect.
Thank you so much.
All right. I do see also Anonymous says, hi, I logged in a little bit late. Please explain the follow-up manager. Do you want to get into that, Sheila, or shall we save it for the recording where our delegates are able to actually go back and see exactly what it is that you went through?
Okay, I'm not going to go back to the demo, but I will just briefly touch on the follow-up manager. The follow-up manager is there to assist the practice manager, the receptionist, with follow-ups. It's got reminders that you can set up for yourself with tasks that you can set out beforehand so that you don't miss anything in the practice. You will be reminded of tasks that need to be done in the future, and you can be comfortable without having a whole lot of papers on your desk of, I need to do this and I need to do that. It's in your follow-up manager, and that manager is there to assist you to follow up on your tasks effectively. Is that a good answer there, Jabu? Do you understand?
Perfect, Sheila. Thank you very much for that answer. All right, and the next question is around a dental lab. So Anonymous wants to know, how does it work for a dental lab?
The very same, because it is a practice management application. And Jabu, I've had some, experience with dental labs effectively moving off from your Elixir or from other software systems that are out there and comfortably and happily working on Elixir Live. It works the same. It is your practice management application. You do your billing, you submit, and your reports, everything is in the program. So I've had quite a few success stories with dental labs that are using Elixir Live. Very happy indeed.
Okay, perfect, Sheila. We do have a question from Paul. Paul says
Okay.
the following, Sheila. You stated that you are required to purchase SMSs. Are
Yes.
there any SMSs included in the base package?
Okay. So I do know that when we do our first installation of the program, our company is kind enough to give you 50 SMSs. You can use that and decide should you want to continue with our SMS functionality. You then have to purchase them going forward. Thank you, Jabu.
Okay, perfect, Sheila. Thank you very much. So there are a few free SMSs that you will
Yes.
get with your initial installation. Okay, perfect.
Yes.
We do have a question
Yes.
from Wendy. Wendy wants to know, do you have ERAs for all medical aid schemes?
Okay, thank you, Jabu. That's a good question again. Yes, as long as your scheme is a real-time scheme, Discovery and Med Scheme and the Metropolitan Group, these are administrators as well as medical aids. In my understanding and being, communicating with doctors and practice managers, as long as your scheme is falling under these administrators, which are your real-time schemes, these ones that have actively participated in allowing their information to go out from their systems, because we are real-time as we stand, but it's up to the scheme whether they want to be a real-time scheme. But Discovery is, Med Scheme is, as an example, yes, from these you will get ERAs, but unfortunately there are some schemes, the smaller schemes, that don't participate. They are not real-time schemes. For these you will have to manually capture your payments back into your system.
All right, perfect, Sheila. Thank you very much for that.
Thanks.
We do have another anonymous question. There seems to be quite a few anonymous folk tonight.
Okay.
Question is as follows. Do you have different data sets for, so basically, can you have different data sets for different disciplines on one system?
Definitely, that is something that we pride ourselves on. Our system is amazing in that way. It's a database, and you can have as many data sets. For example, a group practice, there's a GP, a dentist, physio, whichever discipline. Yes, within the database, you can have as many data sets, and each one will have their own financials, their own patients. They can choose should they want to share patients' demographics across, but obviously keep their financials separately so that they can run their own separate books, run their own financials. But to save time for a patient to come into the medical center and fill in their details at the GP, they go across to the physio, they're all on one system. My demographic will appear as well, but not the financials, and it's separated. The physio cannot see what the GP is doing, has done. That is by consent of the practice, whether they'd like to share information or keep it separate. That is up to the practice, but yes, it's doable.
Perfect, Sheila. All right, so we do have another question from Wendy. Wendy wants to know, if I am on Medimass Plus, ME Plus, can I do a simple migration across to Elixir Live?
Perfectly, and yes, you can. From your Medimass Plus as well, you can do a simple conversion. Yes, it does take between 3 to 5 days, but I do know with Elixir Live and Medimass Plus, with your Elixir Classic and Medimass Plus, you are able to migrate quicker. But we normally say 3 to 5 days. We want it to be perfect before we give it to you. But yes, you can migrate across from ME to Elixir Live seamlessly.
Perfect, Sheila. Thank you very much for that. We do have another question from Anonymous, and I guess this is centered around the times that we're living in with the COVID-19 pandemic. And Anonymous wants to know, does this facilitate telemedicine?
Okay, that's a very, very good question. Okay. At present, Elixir Live is not a clinical record keeping system whatsoever. However, you can do a prescription from your Elixir Live. You can use your telephone to do a consultation with the person. There's online like Zoom, there's Teams, there's a Google Meets, there's your WhatsApp face-to-face. You can then go and produce a prescription from your Elixir Live using our HealthSoft app, which we install within the program. You can then print, sign, email that off to your patient. You can do your consultation through any source, via Zoom, via Teams, Skype, whichever way that it suits you. You can use that platform and give your patient a script, record a note in your Elixir Live. In Elixir Live, it's not your clinical program. However, you can just leave a note on there. There is a space available for you to leave a simple note on Elixir Live. You can also upload documentation onto Elixir Live. However, Jabu, I'm going to use this opportunity to say, I'm sure we're going to have another session, webinar session, where we can then introduce to everybody our clinical application, which will take it a step further. It's completely clinical. It links with Elixir Live. Your demographics come across from Elixir Live into the clinical, and your clinical is just one step further. You can do sick notes, prescriptions, completely clinical, letters of referral, letters of motivation. This is your telemedicine platform. We are there. We are ready. Thank you. Jabu, I hope that answers your question.
Perfect, Sheila. So our system does cater for telemedicine. Basically, we will have those tariff codes loaded for telemedicine in order for you to bill successfully from the scheme, correct?
Yes, correct.
All right, perfect. Right, we do have another question from Paul. Is the system exactly the same for a GP and a physiotherapist practice?
Good question. Every discipline, meaning a GP's codes, are not a physiotherapist's codes. So there's the differentiator already. The GP rates are not the physiotherapy rates. The codes are different. It's the same for a physiotherapist. However, the rates, the tariffs are not the same. The coding is not the same. The modifiers are not the same. When we do an installation for a GP, we've got to make sure that your codes, your tariff, your rates are up to speed, they're correct for your discipline type. When I do an installation for a physiotherapist, I've got to know that these are the modifiers that they use, these are their rates, and these are their codes. So this is done specifically for each and every practice individually. It's the same program, but there is a differentiator within the program. It is program built for a GP or a program for a physio. The differentiator are the codes, the rates, the tariffs, modifiers. Thank you, Jabu.
Right, perfect, Sheila. We do also have another question from an anonymous who asks, please elaborate on your claims administration service you mentioned at the beginning. So basically what MediServe does.
MediServe does. That's a good question. So MediServe, we are based in Midrand. The software, the switching, and the service called MediServe, we've got a whole office of people that do administration of these accounts. So basically, the program that I know that they use and we give to our practices is the Elixir Live program. It is a cloud-based application, which means whoever is in charge of doing the accounts for Dr. Abraham or Dr. Smith will be allocated this doctor's set of books, and this is what they will be working on. So yes, we will access the record, obviously with consent. You have allowed me as the doctor to do your book. So I will do the submissions for you. I will do the follow-ups for you. I will do all of that for you. I will take the pain of worrying about claims from you. And I will do your claims, submissions, reconciliations, follow-ups for you. So that is MediServe. That is what they do. They are a bureau service. That is what they're called. But in fact, they are a claims administration company, and they are part of our company. And yes, they do a lot of good work. Eh? Thanks, Jabu. I hope I answered the question.
No, definitely, Sheila. Definitely, you did answer the question quite well. All right. So I just also have another question from Anonymous. Where do I add my clinical data? If you have any clinical functionality, is the clinical solution and PMA interfaced as one? So that's around the Health One, as well as the Elixir Live compatibility and connectivity there.
Okay, no problem. As it currently stands, Jabu, we are developing a one system, which is called Health 2. But at the moment, we've got your billing, and then we've got your clinical. These two systems are married together in terms of demographics. So if your billing system is Elixir Live, for example, your patient's demographics, contact details, medical aid details, all of that information will be available on the clinical program, which is called Health One. On your Health One program, you are then able to do your clinical information. Don't know about timelines, and I don't want to bind myself into anything, but yes, there is a one program coming where your billing and your clinical are one, and from the billing, you can just go directly to the clinical. However, as it stands, they are not really separated. They are married. Demographics come across to your clinical record. You pull up your record either by account number or surname, and you go ahead and do your clinical record. This is what it is at the moment. We're just waiting for the date of the release of our one product.
All right, perfect, Sheila. Thank you very much for that. All right, we do have a question here. If the consultant bills the wrong medical aid number, will the system pick it up?
Okay, this is, remember, you are now, there's a real-time scheme and there's a non-real-time scheme. In the real-time scheme, you will be notified of your errors that you've made fairly quickly. I don't want to say in 40 seconds, tomorrow you hold me to it and said, Sheila said 40 seconds, but fairly quickly you'll get a response if you've made a mistake. Whereas with the manual capture of a patient that's on a scheme that's not really real time, yes, Switch will definitely respond to you and tell you that you've made an error. On the dashboard of Elixir Live, you saw your error claims screen. On there, you will get that back and say you've made an error here. So we do, from our side, before we even submit to the medical aid, we do checks and balances, medical aid numbers, account, demographics, details, dependent codes. You will get a rejection, but that will be an error claim rejection. Just not as quick as you would get it with the real time, should it not have been a real time scheme, but you will be notified. Yes, you will.
Okay. Perfect. Thank you very much, Sheila. And around the SMSs, I believe there is no expiry date on the SMSs?
Definitely no. Your SMSs, if you didn't use your SMS bundle or however many you purchased within the month of June, for example, they will be carried over for July. Perfect. And you'll also be notified on your dashboard should you be running short of SMSs.
All right, perfect. Thank you very much, Sheila.
Okay.
And another question from Anonymous reads as follows. Can you submit authorizations for specialized dental procedures to medical aid schemes?
Okay, so now I'm just going to break that question up. I do know that still you have to get your authorizations telephonically.
Yes, that's correct.
You cannot go to the medical scheme and request the auth number for you. However, when you submit the claim, in our billing capturing screen, there's a place where you go and put the auth number in, submit that auth number with your claim to the medical aid. But you still have to get your authorization number. You cannot get it through the system via the medical aid.
All right, perfect, Sheila. That's a good answer from us there. Another question from Anonymous. Under COVID-19, how is training done?
Okay, we are so proud to say we've launched our webinar training. And we are also proud to say that Jabu, you and I, today we've had a chance to speak to our clients on a webinar session. This is a first for us and we are excited. But our training has been happening since March when all of this happened, where the shutdown happened. We could not turn our clients away. So our training department came up with this webinar training. It's been going fantastically. My clients are excited. They give me feedback. It works perfectly for them. So we do webinar training sessions with our clients.
All right, perfect, Sheila. All right, yes. So we've got a question from Paul who asks, what are the real differences between Elixir Classic and Elixir Live? So just, at a high level, the main differences between Elixir Classic and Elixir Live.
Not a problem. Thank you, Jabu. Elixir Classic is a desktop application, meaning we have to do the installation for you at your computer. And if it's not a laptop, your program will be limited to your rooms, which means it is not a cloud-based solution like your Elixir Live. So you would not have access to your program from wherever you are. So we do an installation of the program onto your computers. We link all the computers in your practice by LAN, whereas with Elixir Live, we install this in the cloud. There is a little bit of an installation that we do on your computers. However, the differentiator is Elixir Live is available. If you're in Durban, you need access to your Elixir Live, you are able to access it because it is cloud. It's not limited to your practice only. Right, I hope that answers there, Jabu.
Perfect, Sheila. That's absolutely fantastic. All right. And this question is just around backup. All right. So the question asks, what backup solutions are implemented to ensure data is not lost?
Okay. So I want to just give you a little bit of a background about Altron, the company itself, the group. Within the Altron group, we work with bank cards and bank solutions. We've made sure that, so we've got data centers where your data is backed up to. We've made sure that the securities have ticked all the checks and balances because we also deal with banks. So that data is encrypted data. It's backed up double. So we've got 2 backup centers, and we've also got security documentation that we will share with our clients. Should they want to know if we are POPI Act compliant, what securities we've got in place, we will share that information. All you need to do is make contact with your account manager and they will tell you all about the securities. Highly secure. Your data is safe. Jabu,
right. Perfect.
Good.
Perfect, Sheila. All right, so Wendy does ask a question here. Does the ERA interface with my age analysis to post payments received against invoices? Does that update the age analysis? So basically it's around if the ERA interface does automatically reconcile the payments made.
Okay, now I think I understand that question. Okay, so with your ERA, Jabu, you receive a ERA. It's the only difference is it's an electronic remittance advice now. It comes into your Elixir Live. You click on the reconcile button. What happens then is automatically it goes into your accounts and goes and reconciles wherever there's an error, you'll get a report of all the errors. So yes, it's going to change everything that is on your age analysis. Obviously, it's going to reconcile back into Elixir Live. It's going to change your next report when you run that, because once payment is received, it's allocated. Your age analysis will be updated accordingly.
Perfect. Perfect. I'm happy. I'm happy with that, Sheila. Right. So I do see that we just have 2 more minutes left of our webinar session, but I do have a question from Anonymous, right? Anonymous is asking if the integrated e-scripting functionality, is it free or do we have to pay for that?
No, at present, thankfully, we're still giving away free stuff. HealthSoft is the e-scripting tool. You sign up with your account manager. It's absolutely free. We activate that within your program. And if you remember, Jabu, I showed on the diary screen, if doctor works through his diary, if that's the way he prefers, he can then just right click on a patient and go and do a script. It's absolutely free. We just need a form to be filled in. We will do this installation. We will link it into Elixir Live for Doctor and his scripts. We will go further, put your logo letterhead for you on your e-scripting tool.
Perfect, Sheila. Thank you very much for that. And then I just wanted to find out, are there any reports in the system? Can data be exported to an Excel or CSV format? So the reports that we get on the system, are we able to export them, and what are these reports?
Okay, that's a good question, you know, because I know that doctors are medical and they're doing medical treatments, and, you know, the financial side of things, they give it to accountants. That's how most of our doctors are working. We've made it available for doctors. I don't know if you can recall, Jabu, I showed in the demo this thing called the analytics icon at the top there. You are then able to go and request a report. Let's say I want my age analysis. You request a report as normal, but then you are able to export this file in a CSV Excel format, email that file to your accountant, or if you are doing your own accounting function, you are then able to go and work on an Excel spreadsheet nicely, set it up the way you like, check it out, and yeah, that's it. You can. It's available and it's in there, Jabu.
All right. Thank you very much for that, Sheila. And here we have a new practice, right? And this new practice wants to register with medical aid schemes through our company. Are we able to do that?
Yes.
Or do they still have to complete the forms that are required by the medical aid schemes and do that themselves? Can we do that for these practices, for these new practices?
Definitely. Our company, the same MediServe that does claims administration, claiming on your behalf if you so choose, they also have a service that they offer to new doctors where you don't have time to go and sit down and get registered with all the medical aids. They make your life easy. They give you a small fee that you pay, and they will do your registrations for you. So everything is here with us. Jabu, we offer all of these services in-house here.
Thank you so very much for that, Sheila. I do see that we have gone over our time limit, but you know, the answers that you have given us, Sheila, are absolutely impeccable. So it does mean that this company is a company that is able to set up a brand new practice with absolutely no hassles. The practice doesn't even need to fill in these medical aid requested forms in order for them to be registered.
No, that's for sure.
All right. Thank you very much, Sheila. Okay, on our side, we have closed the Q&A. We are done. And now on that part, is there something perhaps that you want to add also?
No, the only thing that I can now suggest or say is log on to our website. Go and see what we're all about. Our contact details are there. You can make contact with our company. We will direct you to the right account manager that will help you to set up your practice, to help you do good practice. Thank you so much for joining us tonight, and it was really a pleasure. Thank you so much. Have a good evening, and bye-bye.